Hi everybody, Y here with TheBurgsrun and coming at you with another update, another unscheduled update. So I got that email that had all those dates of all the things that I had to do, and today was the first thing. Today I had to go for pre-op class. There was probably 8 of us in this class, and then some people brought their caretakers with them. Oh, hey, how do you like the new glasses? I picked them up on my way home from the class today. Anyways, during this video, I'll be popping up the pictures of the slides that we looked at today. So today was patient education before bariatric surgery. And the purpose of the class was to prepare us for our scheduled bariatric surgery, help reduce any anxiety, and also to ask any questions that we might have. So let me warn you now that this can be a pretty graphic. It could be graphic. Not so much pictures, but the words of, because it has topics like preparing for surgery, the day of surgery, review of the surgery, hospital care after surgery, discharge process, care at home, and possible complications. So I just want to warn you up front, this is meant to be informational. This is my journey. This is what I'm going through. This may not be for everybody, and if you find it too graphic, that's okay. You can turn it off. It will be okay. But I said that I would be, that I would take you along on this journey. And this is the real of this journey. So I'm sharing this with you. So the next slide we had was preparing for surgery. Pre-admission testing. I'm going to have to do this 2 weeks prior. Blood work, a chest x-ray, EKG, an interview with the nurse so that they can tell you what medicines you need to stop taking prior to surgery. And then they're going to give me 2 things to take home. They're going to give me a pre-surgery high-carb drink and an antibacterial liquid soap to shower with. So at that appointment, that appointment's at the hospital. Then we have an appointment with the nurse practitioner at the surgeon's office, and this will confirm that for the past 6 weeks you've had no nicotine, marijuana, alcohol, or illicit drugs. A prescription at that time will be sent to the pharmacy. That's my pain medication for after surgery, so they want you to pick that up before you go home. And if you need any forms filled out for work or for anything, you bring them to that appointment. Next slide. 2 weeks prior to your scheduled surgery, you begin your liver reduction diet. It consists of liquids, protein shakes, and foods low in carbs, fat, and calories. So they explained to us the reason for the liver reduction diet, and that is they showed us a picture on the wall. They showed your liver is quite large, almost larger than your stomach, but it is right in the way of where they need to do the surgery. So that you will have a small incision up near your liver for them to use a tool to push your liver out of the way. The smaller and less dense and the less weight the liver is, the less that's going to hurt later. It makes it easier to get it out of the way. It also will maybe not guarantee, but it will lower your chances of having your liver nicked during surgery. So then the next slide is the 2 week, it's a meal schedule daily. You do 2 liquid meal consisting of meal replacement protein shakes, 1 for breakfast, 1 for lunch, or 1 for lunch and 1 for dinner. And then you can have 1 solid meal a day and 1 snack. What she did tell us was to, if you change up, if you want to do your solid meal for lunch, then you need to do that every day. Like, have the same routine every day. What they want to see is an 8 to 10 pound weight loss during this time. If you're not losing weight after the first week, then something is wrong and you need to contact their office. So, of the approved things that you can eat, so for the solid meal, I can have 2 cups of any non-starchy vegetable. I can have broccoli, peppers, squash, tomatoes, carrots, green beans, eggplant, asparagus, cabbage, mushrooms, cauliflower, zucchini, cucumber, onions, spinach, greens, Brussels sprouts, and fresh snap peas. So I could have 2 cups of salad consisting of those vegetables, or I can have 2 cups of vegetables. You can change it up and have 2 vegetables for one dinner, but anyways, that is it. And 4 ounces of lean meat. Also, I can only drink a certain amount of things. So the high protein diet may cause some constipation. So they offered some suggestions. One is making sure that you drink 64 to 96 fluid ounces of water every day. And the other is have Miralax on hand. So the approved fluids, sugar-free, caffeine-free, carbonation-free. So of the protein drinks, there are a million protein drinks out there. The higher the protein, the better. It has to be 15 grams or more and no more than 230 calories. So they give you some suggestions so after my appointment today, I went out and I purchased my shakes already. So water, Hint water, Propel, vitamin water, Zero, Mio, and Fruit 2O. Diet lemonade, Diet Ocean spray juice, Diet V8 splash, Diet Snapple, Gatorade Zero, and Powerade Zero. I can have decaf unsweet tea, decaf coffee. You can use sugar substitute and sugar-free creamer. So I asked them today. I already do half and half and Splenda in my coffee, and she said the only thing I would have to change is to get the fat-free half and half. Perfect. I am good with my coffee. So sugar-free Jell-O and sugar-free popsicles. She said you might want to steer away from the red ones because sometimes they can scare you later. So no red ones, and any kind of clear broth. So that's the 2 weeks prior to surgery. Then, next slide. Preparing for surgery. The night before and the morning of surgery. Your shower with and soap for body wash, scrub. The night before and the morning of, as indicated. And they showed us how to do that. You're going to drink your pre-surgery carbohydrate drink 3 hours before your surgery time. So the night before surgery, the hospital's going to call me and they're going to tell me, just for instance, you have to be here at 7, your surgery's at 10. So I have to drink that drink at 7. So if you use a CPAP machine, you bring your mask and tubing. I do not use a CPAP machine. You do not wear any jewelry. You have to remove all jewelry piercings. Do not wear dentures, contact lenses. Don't use deodorant or tampons if you're female. No artificial nails, so I will have to take them off. Clear nail polish only. She said naked nails are the best nails. And wear comfortable clothes and shoes. The expected stay in the hospital is 1.5 days. So if I get there at 10 o'clock on Monday, I'm going to go home Tuesday at lunchtime. Must have somebody there to drive you home. Day of surgery. So you have registration. So you are going to go in through registration, outpatient registration area. They're going to take us to a holding area where we will be given Tylenol, an anti-anxiety med, and IV antibiotics. Also, to decrease the risk of blood clotting, they are going to give you a blood thinner injection. It goes in your hip. And those things that go on your legs that squeeze and squeeze and squeeze. Then you go to the operating room where you'll go under general anesthesia. And then you'll be intubated and on a respirator. The surgeon performs the surgery. The anesthesiologist will wake me up and remove the tube. None of that will I remember. Breathing on your own and stable, you get moved to the recovery room. So in the recovery room, they're going to monitor for complete recovery from the anesthesia. IV medications for pain and nausea will be administered. And when stable, you'll be moved to the progressive care unit. Next slide. Day of surgery. Monitor overall conditions. This is the hospital care in the progressive care unit. They're going to monitor my overall condition. They're going to monitor my oxygen levels, my level of sleepiness and deep breathing. That comes next. And the intake and output of urine. Then we will ensure that I'm hydrated with IV fluids, bariatric liquids only, sipping slowly using a 1 ounce cup. And she showed us these little cups. They're like the little medicine cups that you get your medicine in. 1 ounce every 4 hours, or every 15 minutes, which is 4 every hour. And then they're going to manage pain with Tylenol, IV morphine if needed, and then you switch to a Dilaudid pill at midnight. They give you an Toradol in your IV for swelling, and they want you to walk for 10 minutes every 2 hours to help get the gases out of your system from the surgery. And then cold packs if you need them for your incision. Then they will give you an anti-clot med, anti-nausea, anti-spasm for your stomach, anti-acid. She said everybody drinks Pepsid or something. Thiamine, which is a B12, and if needed, medicines for your blood pressure and your sugar. Then ensure your activity. They're going to assist to sit up in the chair for 30 minutes. She said once you get up and in the chair, don't get back in the bed because you won't get up and walk. And then every 2 hours with progressing distance, you have to walk. And then the spirometry, 10 deep breaths every hour. Next slide, it explains the incentive spirometry. And then it explains how to use it and what you're looking for. And you're going to do that for 2 weeks at home even. So post-op diet in the hospital. Slide. The evening after your surgery, you'll start on liquids unless you're nauseated or vomiting. The samples are below. Broth, sugar-free Jell-O, Ensure high-protein shake or some type of high-protein shake, water, and Crystal Light. Transfer all your liquids into the 1 ounce little cups prior to drinking. Focus during this time. Hydration, hydration, hydration. Goal: 1 ounce every 15 minutes for a total of 4 ounces every hour. Sip slowly and continuously throughout the day. The goal: 48 to 64 ounces per day. Now, that might not seem like much, but when your stomach is now the size of an egg, it is. So after surgery, early morning, day 1, they're going to draw blood for blood work. They're going to wheel me to x-ray for an upper GI x-ray where I'll be asked to swallow 50 mils of contrast dye quickly. Okay, so that's going to be more than my stomach can hold. So, but what they're doing is they're checking to see if there are any leaks in the operation that they just did. And then you'll go in for a quick upper GI x-ray, and then you'll go back to your room. She said, walk, walk, walk. It will help get that nauseous feeling to go away. After surgery, day 1, morning to noon, they plan for discharge. You must have a ride home, but you have to be able to meet some markers before they'll let you go home. So you must be able to sip 4 ounces every hour for 3 hours of the prescribed liquids without nausea or vomiting. You have to have been walking the hallways around the nurse's station at least one lap every 2 hours. And you've been deep breathing using this barometer every hour. You must meet these discharge goals. Vital signs stable and pain less than a 4 out of a scale of 1 to 10. Voiding without difficulty, incision intact, upper GI x-ray normal, and your blood work normal. Discharged instructions by the nurse. You must be able to tell the nurse your care at home within the next 2 weeks and medications to take. Items that you're going to take home are your discharge packet, your incentives barometer, and 1 ounce plastic cups. They're going to send me home with 2 sleeves of plastic cups. So the care at home. Walk every 2 hours for at least 10 minutes. Manage pain, but you cannot take you can only take Tylenol. You cannot take Aleve, ibuprofen, any of those. Manage your nausea. They're going to give me nausea medicine. Hydrate. Oh, they're going to send me home with pain meds too. Hydrate, 48 to 64 per day. Deep breathing every 2 hours. And if signs of complication, call the surgeon. However, the walking, while you're in the hospital, you have to walk every 2 hours, round the clock, every 2 hours. At home, you can sleep all night. You don't have to walk every 2 hours around the clock. So you have your follow-up appointment at the surgeon's office in 2 weeks. Lifting restriction is 20 pounds, and she said that is the maximum and only if absolutely necessary. And don't get any flu vaccines or anything. No flu or pneumonia or COVID until 2 weeks after your follow-up appointment. So we're talking about a month. So after surgery, there are possible complications. Possible complications can occur 30 days of the surgery or within 30 days or later in the hospital or at home. They can be related to risks of general anesthesia or the surgery itself. So some of the things that you want to look for. Blood clots, bleeding, leak, lung infection, bowel obstruction, dehydration, wound infection, stenosis or stricture, reflux, ulcers, and nutritional deficiencies. Okay. So if you have chest pain with or without shortness of breath, here, this slide too, immediately call 911, get an ambulance. If you're vomiting blood or bloody stools, it can be bleeding and you will want to have somebody take you to the ER. Painful, swollen, or red calf can mean a blood clot. Stop walking and have someone drive you to the emergency room. Persistent or severe abdominal pain, it could be a leak in the incisions. Have someone drive you to the emergency room. Persistent vomiting can lead to dehydration. If it's during regular normal hours, you can just come into your surgeon's office and they will give you an IV infusion. And if your fever, coughing, or difficulty breathing can be a respiratory infection caused from the anesthesia, and to call the office immediately. And incision site, if it's red, painful, and hot to the touch, it could mean a couple of things. You're either allergic to the glue or it's an infection, and they can help you at the doctor's office. So, frequently asked questions after surgery. Is it safe to get pregnant? Recommended waiting. This is the last slide. The last slide. Pregnancy. It is safe. Recommend waiting at least 12 to 18 months after surgery. Follow up with your OBGYN within 2 weeks of surgery to discuss birth control, and you may experience irregular menstrual cycles, including heavy bleeding. Nutrition deficiency. Prevent by regular follow-up with your surgeon to check your numbers and taking prescribed vitamins, minerals, and supplements. May be caused by maladaptive eating, such as emotional eating, poor eating patterns due to underlying depression. May need psychological counseling. Dumping syndrome after bypass. Avoid high fat, high sugar food and drink. Excess skin. Recommend waiting at least 24 months before considering plastic surgery. constipation. Prevent by following prescribed post-op diet and adequate fluid intake. 64 ounces daily. Hair loss. So I'd already looked into this one because I had heard about this already. So my hair has gotten really long and I think I'm going to get a haircut. Some hair loss is common between 3 and 6 months after surgery, almost always temporary, and prevent by taking prescribed protein in the diet. So what she said was it's very common to lose hair during recovery after surgery, that you could make sure that you get a ton of protein because hair grows with protein. So drinking alcohol, avoid for the first 12 months and no bubbly drinks. Why? Calories, alcohol sensitivity, interferes with vitamin absorption, and it may cause ulcers, which can be very painful. And in, like she said, 0.1% of people who have gastric surgery may risk during the first 6 months of surgery gallstone formation, but it's not common. 0.1% of people had that happen. So that was my day today. Fun stuff, right? Well, walking in there and having this nurse explain all of this, and she went through the surgery and showed us exactly what they were going to do, and it's getting real. There were a couple of people that were in there that had their pre-admission testing done this morning before the class. My pre-admission testing isn't for another week and a half. So yeah, it's getting real. Yeah, next week is my last hurrah. I get to go and see my daughter and have some fun and eat all the food, because after Thanksgiving I won't be able to eat any of the food. No, my appointment isn't for 3 weeks, because in 3 weeks. My pre-admission testing is in 3 weeks. My surgery is in 5 weeks. So anyways, I just wanted to share all this with you. This seemed like a lot of information, and the slides that they emailed to me were fabulous. I was able to read them ahead of time so that I could go in and ask the questions. I did ask her, I said, you are putting us on 2 weeks of absolute no fat, no carb, yet the morning of surgery, you want me to drink a high carbohydrate drink. What is the reason for that? And the reason for that is similar to what runners do when they carb load before a race. She said the high carb drink is going to give your body the fuel it needs to get through surgery until you get your first meal. And the first meal, now remember, is not until the evening after surgery. So if you take this at 7 o'clock in the morning on a Monday, you're not going to have anything except ice chips until dinner time on Tuesday. So that high carb drink is just similar to carb loading before a long race. So that's all I had for you today. Again, I will keep you posted as things come up, because I said I was going to take you along with me on this journey. I have to get my book out and start writing in it so that I can remember everything, all the feelings and everything post-surgery. Or, I'm going to share my weight with you the morning I start my liver reduction diet, so that we can see if there's any weight loss between then and surgery morning. So, there's lots more to do. So in 3 weeks, I'll have that pre-admission testing, and I'll come back with an update with that. So until next time, have a fab day, everybody.